Well, let's figure out what the government's new Child and Youth Wellbeing Action Plan is all about and get a review from BC's representative for children and youth, somebody who, I think wanted to see this happen. Jennifer Charlesworth is joining us on the line. It's Jennifer Charlesworth. Hello, how are you?
I'm well. Good morning.
Thanks so much for joining us and helping give us some context to this. So I saw this in the news, but I'll have to admit, I need a bit of context for this and where this comes from and what it does. So I was hoping you could kind of help us out here.
You bet. So 2 years ago, we released a report. It's called Don't Look Away, and that was the result of an investigation into the death of a little boy that we called Colby, an 11-year-old child who died in the hands of his ministry-approved caregivers. We looked closely at his story, his family's story, and the stories of 14 other children and identified some key systemic issues. So his death was an absolute horrific tragedy, and we also saw that there were patterns of concerning actions, practices, policies, legislation in the broader system that impact thousands of children. So we recommended to government at that time that in order to honor Colby's sacred story, they needed to make some big changes, as well as some short-term, quick impact, let's get going. And one of those changes was to start coordinating services across government, not just with the Ministry of Children and Family Development. And we called for what we call a Child and Youth Wellbeing Strategy and Action Plan and a way to measure outcomes, and that's what was delivered by government yesterday.
Now, using that example of Colby, as you mentioned, this child in foster care who tragically died, what broke down in that case that gets addressed in this action plan? Maybe just, to use that as an example of how things could change, how things could change because of what's been announced here.
Yes, excellent question. So Colby's family had interaction with multiple systems. So he was born with disabilities and he had significant medical needs. So the healthcare system. His family was living in poverty. So there was income assistance, housing precarity, food insecurity, family violence, intergenerational violence, mental health concerns, and substance use concerns. So when you bring all of those things together, and let me be clear, it was a loving family that was trying very hard to overcome their history and their current challenges in order to raise their children. So if you see all of those systems are independent systems, siloed systems, income security is disconnected from health care and prenatal care and postnatal care, and anti-violence work and police-related victims' response is disconnected from mental health counseling. So what we said was there were countless missed opportunities because the system was not coordinating and collaborating to see the bigger picture of this family and the way in which it might have helped. So the Child Wellbeing Plan, the intention behind it is that there will be much greater coordination between the various parts of the system to more effectively wrap around families that are struggling and to assist them before things get terribly bad, as they ended up getting with Colby and his family. So a little example that I find really powerful is when Colby left the hospital after being in the NICU, the neonatal intensive care unit, no one thought to ask, do you have the money to purchase the specialized formula that your child is going to need? Do you have a safe bed, safe sleeping arrangement? All those kinds of things that just gives families, it's not a crisis yet, but it is going to be a crisis if they don't have the supports that they need. So family living in poverty don't have the resources to make sure that the child is getting their nutritional needs met because they can't afford the specialized formula. They water it down. So simple little things like that cumulatively over time become more and more stressful for families. And then, of course, we did experience and see significant substance use and mental health concerns as time went on and housing precarity. So those kinds of opportunities of intervening to help a family a little bit to prevent the cascading effect of harms over time.
Now, one of the big things you just mentioned there is that better coordinating of support for children and families across those different ministries and services. Now, government's pretty famous for not working necessarily well with its different departments. I mean, I think anybody who's had to deal with government bureaucracy and you fill out a form and you're like, I just filled out this form for this department. Why am I doing this again for this? There's all these different examples of how there's not a lot of coordination. It seems, at least from us, the kind of like user of government services side of things. So how much faith do you have in this actually happening, or how do you overcome those inherent disconnections in government?
You've nailed it. That is the big challenge, and it's one of the reasons I think that it's taken 2 years since we released our report to get the action plan, because you can put a plan on paper, but if you don't have the mindset and the approach behind it, the attitudes and beliefs that this actually is really, really important and this is how we're going to do it, you're going to keep replicating the same old thing that we've had forever, which is, as you say, you tell your story a dozen times, you think you're opening a door, but it closes in your face. So the intention here, I think, is they've taken time to figure this out amongst the ministries and amongst the public authorities in order to have a much better chance at it. And they're starting to use things like Citizen Services and Connected Services BC to streamline, so using technology to start to streamline those entry points and those connection points. So I am, as I often say, because I'm an independent office, I am optimistic but cautiously so. So we will be monitoring very closely to see if the changes happen in the lived reality of the young people and the families that we all care about.
Yeah, and we are talking to BC's representative for children and youth, weighing in on the government's new Child and Youth Well-Being Action Plan, which, as we've just discussed, is a critical thing because, you know, we've had these cases of tragedies with children in care in BC, and how do we better serve those children? How do we better have, avoid those outcomes? And that's at least what this plan is trying to address. But as you said, I guess it's good on paper. Let's see if it actually meets the needs, and you'll be watching for that very thing and giving us that update.
I certainly will.
All right, Jennifer Charlesworth, always a pleasure to talk to you. Thank you so much for joining us and sharing some thoughts on this. Anything else you wanted to add or anything else we missed?
The one thing I would like to add is that we focused a lot on government, which is absolutely important. They have a responsibility as citizens of British Columbia. But the other thing is that if we really center the well-being of children, if we want all children to experience love, connection, belonging, and a sense of possibility in their lives, that's not just government's responsibility. That's us as family members, as neighbors, as coaches, as teachers. So we've all got a responsibility to the young people in our lives and in our midst. So, let's not just look to government. We also have to look to ourselves to be supportive of our young people.
Good stuff. Thank you for your time.
Thank you. Take care.